Are you fully aware of the unexpected side effects and hidden health risks of eating blueberries? On the surface, these tiny, colorful berries look like the perfect health food. They're sweet, refreshing, and bursting with antioxidants, fiber, and essential vitamins. For years, nutrition experts have labeled them a superfood, and with good reason. Blueberries have been linked to lowering blood pressure, improving cardiovascular health, boosting memory, enhancing post-exercise recovery, and even slowing cognitive decline as we age. But here's the truth most people don't hear. Blueberries are not safe for everyone. For certain groups, regular or excessive consumption can trigger health issues ranging from mild discomfort to potentially life-threatening complications. And the danger lies in the fact that many of these risks are not immediately obvious. They build silently in the background until something goes wrong. So before you add another handful of blueberries to your breakfast bowl or blend them into your smoothie, ask yourself, am I one of the people who needs to be cautious? In this video, we'll uncover the 5 groups of people who should think twice about blueberry consumption. And I'll tell you now, number 2 could surprise you because in rare cases, it could even be fatal. But before we dive into all that, if you're new here, welcome to the channel. We're here to help you live healthier, feel better, and age vibrantly. Be sure to like this video, subscribe, and turn on the notification bell so you never miss a wellness tip that could change your life. And tell us in the comments, where are you watching from? We love hearing from viewers around the world. Blueberries are nutrient-dense, but their unique chemical composition, vitamin K, salicylates, fructose, tannins, and anthocyanins, means they can interact with specific medical conditions and medications. While these compounds are generally beneficial, in certain contexts they can become problematic. Vitamin K can disrupt blood-thinning medications. Salicylates can cause allergic reactions in sensitive individuals. High fiber and fructose can worsen digestive issues like IBS or fructose malabsorption. Polyphenol may interfere with the way the body metabolizes certain drugs. Contamination risks, like mold or pesticide residues, pose hidden dangers if berries aren't washed or stored properly. Do you eat blueberries regularly? If yes, how do you usually consume them? Fresh, frozen, juiced, baked into desserts, or blended into smoothies? Your personal experiences matter, and sharing them might even help someone else who's struggling with similar symptoms. Drop your story in the comments below. I read every single one. Now let's dive into the details and break down who should be cautious, why these risks exist, and what the science says about it. 5. This group that should think twice are those with a history of kidney stones. Take Clara, for instance, a woman in her 50s who loved starting her mornings with a big bowl of blueberries and raspberries. After dealing with recurring kidney stones, her doctor explained that these berries are high in oxalates, compounds that can bind with calcium in the kidneys and trigger stone formation. According to research published in the American Journal of Physiology, 2002, prevention of calcium oxalate stones involves a 3-part strategy: staying well hydrated, avoiding excessive intake of high oxalate foods, like spinach, beets, and berries, and maintaining adequate dietary calcium to bind oxalates in the gut rather than in the kidneys. For individuals like Charlotte, moderation is key. Enjoying blueberries occasionally without overindulgence can help balance the benefits with reduced risk. But here's the bigger picture. Are blueberries dangerous? For the majority of people, the answer is no. These risks are relatively uncommon and usually only apply to individuals with specific conditions or medication use. In fact, for most people, blueberries remain one of the healthiest fruits you can eat. They're packed with anthocyanins, powerful antioxidants that help reduce oxidative stress and inflammation, 2 major drivers of chronic disease. Studies suggest they may support heart health, sharpen memory, and even offer protection against certain cancers. On top of that, blueberries are rich in vitamin C, manganese, and fiber, are low in calories, and have a low glycemic index, making them an excellent choice for blood sugar control. What makes blueberries unique, however, is that they touch on several risk areas at once: vitamin K interactions, high oxalate content, potential digestive effects from fiber, salicylate sensitivity, and drug metabolism issues. This combination is what places them under the spotlight when discussing possible downsides. Awareness and balance. If you fall into one of the at-risk groups, it doesn't mean you need to banish blueberries from your diet forever. It simply means you should enjoy them wisely, in consultation with your healthcare provider. For everyone else, blueberries can absolutely remain a staple in a healthy, balanced diet. 4. The fourth group that should be especially cautious with blueberries are individuals taking certain medications. Earlier, we touched on blood thinners like warfarin, which can be influenced by the vitamin K content in blueberries. But the concerns don't stop there. Blueberries also contain natural compounds that may interfere with how the liver metabolizes medications. The liver uses a family of enzymes, known as cytochrome P450 enzymes, to process and break down many drugs. Blueberries, particularly their polyphenol and flavonoids, can alter the activity of these enzymes. What does that mean in practical terms? If the breakdown of a drug is slowed down, the concentration of that medication in the blood may rise, leading to stronger or even toxic effects. Conversely, if the liver breaks down the drug too quickly, the medication may become less effective. Medications that could be affected include certain antidepressants, SSRIs and tricyclics, where altered metabolism can change therapeutic response. Beta blockers, commonly used for blood pressure and heart conditions. Non-steroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen or naproxen, where interference could increase gastrointestinal or kidney risks. This is why, if you're planning to add a large amount of blueberries to your diet, especially in supplement or concentrated extract form, it's crucial to consult your doctor or pharmacist to ensure no dangerous interactions occur. 3. People with gastrointestinal disorders. Blueberries are high in dietary fiber, about 3.6 g per cup, and natural sugars, particularly fructose. While these support gut health in healthy individuals, they may worsen symptoms in those with irritable bowel syndrome, IBS, Crohn's disease, or fructose malabsorption. The World Journal of Gastroenterology, 2017, explains that excess dietary fiber can trigger bloating, abdominal pain, and diarrhea in patients with functional gut disorders. Similarly, in cases of fructose malabsorption, undigested fructose ferments in the colon, leading to gas and discomfort. David, a 42-year-old with IBS, added blueberries to his daily oatmeal. Within a week, he noticed worsening bloating and cramps. After consulting a dietitian, he learned that portion control, limiting himself to half a cup and pairing blueberries with protein-rich yogurt, helped him tolerate them better without flare-ups. If you have digestive sensitivities, introduce blueberries slowly, start with small servings, and observe your tolerance. Cooking them, such as in compotes, can make them easier to digest by breaking down fibers. 2. Individuals allergic or sensitive to salicylates. Blueberries naturally contain salicylates, plant-derived compounds also found in aspirin. For most people, they're harmless and even beneficial due to their anti-inflammatory properties. But for those with salicylate sensitivity, they can cause a spectrum of reactions from mild stomach pain, rashes, itching, to severe anaphylaxis. Research in the Journal of Allergy and Clinical Immunology, 2015, reported that high salicylate foods often trigger symptoms in sensitive individuals. Blueberries contain about 28 milligrams of salicylates per 100 g, which is significantly higher than many fruits. For example, apples contain just 2.8 milligrams per 100 g. Jane, 35, tried homemade blueberry juice for the first time. Shortly after, she experienced nausea, diarrhea, and itching. Medical tests confirmed she was reacting to salicylates in the fruit. Once she eliminated blueberries, her symptoms resolved. If you notice repeated symptoms like headaches, rashes, or stomach pain after eating blueberries, consult your doctor. Keeping a food journal can help identify patterns and confirm whether salicylates are the cause. 1. Individuals with bleeding disorders or those on blood thinners. Blueberries are an excellent source of vitamin K1, phylloquinone, which plays a central role in activating proteins needed for blood clotting. For most people, this is beneficial. However, in patients taking anticoagulants such as warfarin, rivaroxaban, or apixaban, excess vitamin K intake can interfere with the drug's mechanism. A study published in the American Journal of Clinical Nutrition, 2016, found that fluctuations in vitamin K intake significantly affect international normalized ratio, INR, stability, a key measure used to monitor blood thinning therapy. Unstable INR values can increase the risk of either bleeding, if the blood is too thin, or clot formation, if it becomes too thick. Lizzie, a a 60-year-old woman prescribed warfarin, started drinking a daily blueberry smoothie thinking it was a healthy choice. Within weeks, her INR levels became unstable, forcing her doctor to readjust her medication dosage. She wasn't asked to completely avoid blueberries, but was instructed to keep her intake consistent and moderate. If you are on blood thinners, it's not about eliminating blueberries. It's about avoiding sudden increases in intake. Always discuss changes in your diet with your healthcare provider. For the vast majority of people, the answer is a reassuring no. If you've been enjoying blueberries without any issues, chances are you can safely keep them in your diet. The potential risks we've covered, whether related to blood thinners, kidney stones, or drug interactions, are generally limited to specific groups of people and are relatively uncommon. That said, it doesn't mean you should eat blueberries by the handful without a second thought. A sensible approach is to start with moderate portions. Pay close attention to how your body reacts, and be mindful of how often you're eating them. If you notice unusual symptoms like digestive discomfort, skin reactions, or changes in how your medications affect you, that's your body's way of signaling you to slow down and consult a healthcare professional. It's also important to remember that no single food determines your overall health. Blueberries are celebrated as a superfood because of their antioxidants, anthocyanins, and fiber, but they're not irreplaceable. If you do need to cut back or even avoid them, you can easily get similar nutrients from other fruits like blackberries, strawberries, pomegranates, or even leafy greens rich in vitamin C and polyphenol. A common misconception in nutrition is believing that if a food is healthy, then more is always better. But science tells us otherwise. Nutrition is highly individual and context-dependent. What benefits one person might cause problems for another, depending on genetics, health history, and even lifestyle. That's why the best approach is to stay aware of your unique health needs. Observe how your body responds to different foods, and don't hesitate to question even the most popular health advice. So next time you're at the grocery store eyeing that pint of blueberries, pause for a moment and ask yourself, are these the best choice for me right now? If the answer is yes, enjoy them guilt-free. If not, there are countless other colorful, nutrient-rich options waiting for you. And before you go, if you found this video helpful, let us know by typing yes in the comments below. Don't forget to like this video, subscribe to our channel, and turn on notifications so you won't miss our upcoming health insights. Share this with your friends and family, so they too can enjoy blueberries wisely and safely. Your engagement really fuels our work. It shows us what matters most to you. And before you leave, check out these 2 recommended videos we've picked just for you. Thank you so much for watching. Stay informed, stay healthy, and until next time, take care of yourself and your loved ones.